Greetings again, this is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you today some about palatal separation. When we started, this case right here is the first one that I ever put pressure on the front teeth out here to help separate the palate. In other words, we've been using palatal separation, and we still do, or still did, back around the molar area where they pushed apart. And I remember asking the young man that had written the book on palatal separation from England, Dr. Tillms, I believe, and how old he could separate the palate. He said, well, about 17 or 18, and the sutures get so tight you can't go apart with them. And I didn't talk to him any more than a lot of people waiting there to talk with him, and I just walked away because I'd already separated some people that were in their 30s and 40s, a few in their 40s, by putting pressure in the front part of the mouth as well as in the second molar area back here in the back. And this young man, I had started, and I was cranking on this, and the pressure was irritating him, and you feel it when the pressure's on. And he came in one Saturday morning about 10 o'clock, and I put this spring in his mouth. Let me get over here and show that to you. We got this fellow back, and he came in Saturday morning, and it was still hadn't gone apart. And this was started in 73. I started earlier in 73 and got up to this point, but I couldn't get the thing separated. So what I did, I put a spring in this kind of, we take a spring coming down something like this. I'm just guessing how we went up here and we wind that, we put that together and put it down in between his teeth. Right down there and put it in the deal. Let me get in and show it to you a little closer. Now this is not only that, but the whole bicuspids and everything on the sides of his mouth were sunk in from vacuum that pushes that in. Now here's the spring. I drew it kind of long. We just came down and came up like that, and then we just made this circle like this and went off the side. Now when we close these together, like here you pull these teeth, we put it on the teeth this way, see? We bring these legs around this way and put that on his teeth and run that in the bracket slot of the teeth. Now this tightens that spring up, you see, so it's got a lot of push on it, and this was Australian wire, I think about 016, and we put that in 5 of 73, and now we're going to go to the next. And here it is in the mouth now. We had to take these legs and go up like this, so we could tie them in on the bracket, and they were pushing against this, like that. They're pushing this out. Now, this was at 10 o'clock in the morning when we did that. We put that on at 10 o'clock in the morning. He was kind of irritated with me for having to put all this pressure on him. And maybe I was a little irritated with him too, but I put that on him, and he and his girlfriend went down to town to Fort Worth to a window shop or shop, whatever they were doing. And they came back in the afternoon, dropped back by there about 4 o'clock that afternoon, and it was like that. He said he didn't know when the separation took place. He said his girlfriend looked at him and says, hey, your teeth are apart. And he went up and looked in the glass window of the store and looked, and there he says, I could stick a wooden match between my front teeth, and he hadn't even felt it go apart like that. So we spread it out, and from then on older patients, it's really better I used just separating this going straight across here with springs. If he had gone on for several more hours, I believe these teeth would have been set out like that, and this spring would have pushed them that way. So it's a good thing he came in. I didn't dream that he'd opened this gap, but it opened it, and he didn't feel it. In other words, the sutures between the palate don't actually have nerve endings in them, and you can move it apart, and they don't even feel it come apart. Once it gets apart, the pressure's off, and they don't feel discomfort up here. So anyway, that's what's happened. Now I'm going to propose that people, I didn't try this, I should have, to put a tad or a screw in the tissue right between the lateral and the centrals here, and put it has a opening in the tad, you see, and if you run a wire through there, it comes out, maybe comes in, has something to stop it on the inside from the back, and then come in here and put condensed spring in that, and you're pushing on the bone structure up here rather than pushing on the teeth, and then the teeth transfers the force to the bone structure. Put it straight to the bone structure. Now, but anyway, putting it on the teeth works. Like you could come through here with a spray on this area right here, pushing on it. That's what we've done for several years. I've never really tried to put the tads in there and push on the bone structure. You put more force on it, and they don't move. So they're separated better that way. Now let's go ahead, and I'm going to erase all of that, and we'll see. Now this was he came in at 4:30 Saturday afternoon, after 10 o'clock. So this all happened in that length of time. In fact, it happened in just a short time. While they were in town, and he came back by the office, and I'm glad he did, because we took that out and put a straight wire in there. Now let's go on to the next picture. Here's these teeth were rotated too. So these wires are going straight. We pull them over here, so they're not only pushing these teeth apart, they're rotating the teeth. They're going to line these teeth up, something like that. And then we'll come in here with spring, excuse me, and we'll expand that. Now we've been pushing back here with this, and this wasn't taking it apart. And this was soldered on here, you see, over these teeth. We probably should have done this to start with, but we had to buy customers in here and give us a little more bone structure there to push apart, handle on the bone structure, I'll say. So anyway, here's where it spread out like that. And then we went on and took this, and we pushed this apart more, and that spring rotated these teeth. Then we came in here with little condensed, closed, open coil spring, and pushed out room for the laterals. And I'm going to try to run this. I don't want to do more time with this showing it than I have to. And here we're pushing this apart. And so I'm going to propose that you could come up in here somewhere between these two teeth and put these tads and put spring pressure in that area. And you could open this, well, instead of there, you'd put it between here and the other side and spread these teeth apart. And I think you could open somebody's palate up there when they're in their 40s. We've done a few into their 40s, but not too many. But in the 30s, we were able to do it. Now we're just straightening the rest of this out, just regular orthodontics. I won't run on. We've covered most all of this stuff. But we put this spring, we put this spring around this up and stopped it here, see? So it's going apart. It's opening up, and then we'll bring these laterals into that gap. All right, we're like that now. And it went from that thing. We're also going to open this a little bit more, but we're going to have to get this lined up and get this thing out of here. Then we'll take a large arch wire and bring this bite out in that shape. All right, the lower we extracted the bicuspids down there, and we're expanding the cuspids. And you've got to have the root distal to the crown. When you when you expand the cuspids on the bottom or the top, you need the root to be tilted back. You don't want the tooth like this. You have to take the tooth back this way. And that's the problem with expanding the lower anterior down here. If you expand it and you just glue the crown over, then it'll come back. But if you take the root back, which takes longer to do, you'll keep the thing, will stay back there. It doesn't have any sacred position for the cuspid teeth in here. They have their own, but you need to get the root distal to the crown when you come in there. So anyway, we've rounded that off. This is still in 1973. We've done this, I think, all of it in what it was in 73. And now it is, we've got it just about lined up and here ready to go. We're going to take this thing out, and we close that space up. We've got some duplicate slides in here. Now we're closing with elastics and lifting that bottom part up back here as we close it together. I'm going to run on through this. We needed to slide this sideways a little bit, and we need to widen the upper arch and keep it out a little bit wider. So we use these elastics here. And this is a midline elastic. It's kind of a class, it's almost class 3, that way. And now we're getting lined up like that. You see we've got a normal form to this now. And if you tell me that these teeth can't be moved, they were in here somewhere, moved out here, the bone structure still filling in there, but they have bone structure on the outside. And I'll show you this guy several years later, and they're still there. And we put the teeth where there wasn't bone. And you can do that if you take them gradually and move a group of them especially. You can carry those teeth out in that fashion. All right, here we've finished it up pretty much in 76. We put a upper retainer in, and there it works. We're closing this gap right here, coming together with that, and here it is in something 76, and there it is in 1988. He let one tooth decay. It had a big old filling in it when we were treating him, and he lost the filling, and he hadn't gone in and had it redone, I guess. He was brushing like mad, and whatever, this is overdone. Like you should have taken care of that tooth better. But this is 1988, and we started in 73. Now here it is in 76. Now, this is the, excuse me, get to where I can't talk. This tooth right here had a big old filling in it. See it right here? See that filling? And that thing came out after we had closed the space. So this tooth was up against that when he lost that filling. And he hadn't gone and filled it out, so I really fussed at him for leaving that tooth. That was an important tooth. It's still solid, so I had to get that filled or crowned or something. And we got his wisdom teeth. I don't see it over here, but his wisdom teeth on that side of the mouth. Now look at the arch form that we have here. And I'll pull that first picture up here look at the arch form we had here. Now you tell me we can't put these teeth in bone structure, move them out there. Look how far they are apart here. It wasn't too much more than here, but then the lateral teeth right here, you put it in, and they're that far apart, and there's bone structure on the laterals, there's bone structure on the bicuspids and cuspids and everything. And you can move teeth and spread them out like that, and the bone goes with the teeth. If you're going where there's soft tissue, if you're going forward and it's softer up above, but if down here you got to put a lip bumper and run interference for the teeth. If you're going to move these teeth forward, you got to move, get out in front so there's a millimeter or two of space, and soft tissue can precede the movement of the bone. So that's the necessary thing if you want to move teeth out like that. So anyway, this is 1988 right here, and this was 1973. So there's several years in here before we come back. We were using bands in it, had a little space, but this, and there's the lower arch in 1976. In 1978, it's still pretty well lined up like it was. And here is the gentleman, and he was in his 20s, and he was in postgraduate school at North Texas when he was coming in. And that's something I said, the bicuspids being sucked in like that is caused by people forming a vacuum in their mouth. And I'm going to cover another case on where the bicuspids and stuff are sucked in by forming a suction up here and swallowing 2 or 3 times, and you create a pressure and pushes that in on the bicuspid. We spread it out and put it in a retainer. You'd have to wear that retainer off and on for a long time there, because you probably still in the habit of swallowing during your sleep. I'm going to shut up now and get on down the road, but thank you for watching. And there's all sorts of things you can do with the appliances that we use today. There's hardly any tooth movement that you can't perform with that appliance. And the quicker, the better. And you get less time doing it than you do with other things that you can push them around, but you can't rotate them properly and everything. So I'm going to hush and go on. And thanks for watching. I hope you'll join my channel, and we'd like to have you. And don't just thumb through these things looking like you're through a catalog or something. Study the videos and see what actually was taking place in here. So that's what I want you to do. Spend some time with this if you really want to know it. Now, if you're just an individual looking to see what can be done with your teeth, and your orthodontist or whoever is straightening your teeth doesn't know how to do it, take the video to him or tell him about it. Show it to him. We've tried to put this out for everybody anywhere in this world that's got in the internet to do that. Thank you now, and I'll close up and go.